Initiating therapy. The first thing in initiating therapy, as we said before, is to identify the need. So first we have to identify the patient has sleep disordered breathing, which is typically done from a first night study. Even if a patient has a positive home sleep test, if we're going to titrate them in the lab, they typically come in for a first night study. One of your roles is going to be to educate the patient. You're going to tell them about CPAP, that it delivers a continuous positive airway pressure to their airway, and it works by splinting the airway open with air pressure, which by holding the airway open, it will prevent their airway from collapsing, and it decreases the airway resistance so they can continue to breathe normally during sleep. If you notice the picture to your right, there's a little head there with the CPAP mask, and it's showing the arrows of the air pressure being delivered to the patient's airway, backed by the genius glossus muscles and the narrower points of the airway. That pressure is going to hold that open so it can't collapse on the patient. One of the other things you're going to educate the patient on is how it can improve their daytime sleepiness, how it can reduce their blood pressure, and reduce other health risks. If we can breathe effectively while we sleep, our body gets the rest it needs, and we're able to better function during the day, or function as we should function during the day. Treating sleep apnea does lower blood pressure. It does reduce health risks. One thing it will not do is if a patient has already developed diabetes, it will not cure their diabetes, but it may help them manage their diabetes more easily. If you look to your picture, so once the patient is at the sleep lab and they know they're there for a CPAP titration, the first thing you're going to do is have them select an interface device. An interface device would be how the CPAP machine is connected to the patient's face, basically. It's always best to have the patient try a few different styles or have them at least look at the different options. One important question is to ask the patient to plug one side of their nose and see if they can breathe through the other side, and then switch sides and do it the other way. If they cannot breathe through their nose, then they're going to need a full face mask that covers both their nose and mouth. If they can breathe freely through both nostrils, then a nasal mask or nasal pillows may be more comfortable to them. Nasal pillows are known to have the least amount of leakage of all the interface devices, so that's always a good option if the patient likes it. The next step is to habituate the patient to the device, also termed desensitize the patient to the device. To do this, you let them hold the mask on their face with their hands with the CPAP pressure turned on at the lowest setting. This gives them control of the situation. They can remove the mask quickly if they want to. They can take it on and off a little bit. You explain to the patient while they're holding this on their face how the pressure will change during the night when they sleep. And then you can increase the pressure a little bit just so they know what that feels like, and then decrease it back down to that starting pressure again. Explain to them again how this air pressure is holding open their airway so it cannot collapse on them while they sleep. When we go to sleep, our muscles relax, and that extra weight can compress our airway because we lose muscle tone while we sleep. And you know, especially in REM, we go completely paralyzed. So if there's no muscle tone, that can lead to the airway collapsing. Eventually, when they're comfortable, you're going to go ahead and attach the interface device to the headgear, and you're going to go ahead and put the straps on their head and get it adjusted so there's no leak around there. Although you don't want it too tight, you want it comfortable with very little air leaking outside the mask. You can have them read or watch TV for a while with this on just so they can get used to it. And then when the patient and you are both ready, you can have them lay down, you can do your biocalibration, and then have them go to sleep. Let's go on to our next slide. Different interfaces to try. There are numerous styles of interfaces out there, and more are being developed every day So you really just, you're somewhat dependent on what your facility stocks, but going to the national meetings, or if your area has a state meeting or a regional meeting each year for sleep technologists, those are great places to learn about different interface devices out there. But the primary options right now are a nasal mask that just covers the nose, a full face mask that typically covers the nose and mouth. There's nasal pillows. Those sit up inside the nasal cannula. There's a nasal cannula type. That one, it sounds similar to the pillows, but the device is much different. Then there's a hybrid mask. And like I said, there's more and more being invented each day. So let's go on to our next slide. Initiating therapy. This would happen hopefully before you get the patient in bed and say goodnight, but we always want to make sure that we can identify and correct any leaks or anything uncomfortable before we start testing. So an important question to ask your patient is if they feel air leaking into their eyes. Air leaking into the eyes can cause corneal abrasions, so it can damage their eyesight, so we don't want that. With your hand, you should feel around the outside of the mask where it meets the face, and you shouldn't feel any air leaking around there. Tightening the mask isn't always the problem. You may actually need to loosen it, but you do want to make sure it's resting at the right location on the nose, and check to make sure that it's not resting on that the nasal bridge that can get sore. You want to assess for the need of humidification. Does the patient nose get dried out or sore? Humidity can relieve dryness, congestion, or sore throat from CPAP machines. And then anytime your patient has a complaint about it, you want to try and go in and troubleshoot the device to correct that. For example, if you have a patient complain that it's pinching on their nose, you maybe have the mask a little too tight, so you would want to go in and try to adjust the mask, have the patient hold it where it's comfortable, and then adjust the straps accordingly. Then again, before you leave, feel around the mask to make sure there's no leakage. Let's go on to our next. If a patient has any adverse effects of PAP therapy, it is directly related to patient compliance. If a patient doesn't feel comfortable with their PAP device, they're not going to wear it. So one of our big roles is to eliminate and minimize any adverse effects or complications the patient has as soon as the patient notices them, as this is going to help the patient want to wear their CPAP every night. Always educate your patient on what is normal to feel with PAP therapy, and then help them communicate their adverse effects as they encounter them to you. So encourage them that I can only help you if you let me know what's bothering you. Tell me what you don't like about it, and let's see if we can find a solution together. And it could be a variety of things, but you have to make sure you open up that door and let them know it's their responsibility to let you know when they're having problems so you can help them. Let's go on to our next slide. Other factors that can improve compliance, of course, education is a huge role, how it's going to benefit the patient for their lifelong as well as the immediate future, what their role in their treatment process is, that they need to let you know when they're having problems so you can help them solve the problems, understanding life consequences if they choose not to wear their CPAP, need to provide positive reinforcement, encouragement, need to do follow-up procedures. And this would be calling them, asking them how they're doing with their CPAP. Do they have any questions? Do they have any issues that they have encountered that you and them can solve together? And then that goes along with the next box there, problem solving. Let's go on to our next slide. Some additional features that we use on our CPAP devices for patient comfort. We have what's called a pressure ramping, and this is when the patient first puts the CPAP on at night. We can use a ramp, and we can usually set it from anywhere from 5 minutes to 30 minutes. So let's say they're on a pressure of 10 centimeters of water pressure of CPAP, and we want to use a 20-minute ramp. We can have the patient put the machine on, and we'll start the machine, and over the next 20 minutes, the machine is slowly going to ramp up pressure from a pressure of 4 all the way up to its pressure of 10. And then once they're at 20 minutes, hopefully that patient is asleep and they're at their prescribed pressure. So this is for people who, when they put it on at the prescribed pressure, maybe it feels like a little bit too much, and so this gives them time to fall asleep prior to the pressure being that high. There's built-in memory features. Actually now they even have Bluetooth where the data can be downloaded via Bluetooth to their computer, and so compliance can be tracked. But the memory, they can do little chips or little memory cards, and they can download the data on that, and then their physician or their durable medical equipment can download that data to track patient compliance. A lot of insurance companies base their reimbursement on the patient compliance, and we're going to talk more about that later as well. Then there's expiratory pressure reduction. This is called C-flex or EPR. And what this is when the patient goes to switch from inspiration to expiration, sometimes they feel like they have to really push out to exhale. And so if we use this C-flex or EPR on a machine, what it does is it drops that pressure just a little bit for them so they don't feel like they're blowing out against it. So it's just a comfort mechanism or option. Let's go to our next slide.